Let's continue with the window of heaven points. GB9 heavenly rushing. Location 1.5 June directly superior to the apex of the ear. GB20 and 0.5 June posterior to GB8. The point approximately superior to the posterior margin of the ear. To find, first locate GB8 1.5 June superior to the apex of the ear. The latter becomes more clearly defined by folding the auricle towards the anterior so that the posterior part of the upper helix covers its anterior part. From GB8 measures 0.5 June in a posterior direction and therefore locate GB9 similar to GB8. GB9 is located in a slight dip in the bone. Both GB9 and GB12 in the depression posterior and inferior to the masted process are reference point for a curved line that runs approximately parallel to the posterior margin of the ear within the hairline. When dividing this line into thirds, GB10, GB11 are located at the junctions of the thirds. It link 0.5 to 1.5 June transversely, subcutaneously towards the occiput on or the site of the pain. Action indication, it expels wind and heat, opens the loop connecting vessels, comes the Shen. Special features, meeting point with bladder channel, window of heaven point according to some authors. GB9 is a very important local point of the gallbladder channel. First of all, it is very much used as a local point for migraine headaches on the side of the head from rising of liver yang, liver fire, or liver wind. This point helps to subdue the rising of rebellious chi and conducts it downward. Another important function of this point is that of eliminating interior wind and its manifestation, especially convulsion, epilepsy, or contraction of muscles. GB9 has a powerful mental effect and is used to calm the mind. In serious mental disorders such as hypomania, it is an important adjuvant to the treatment with distal points. This point is also used for disturbance movement, such as ataxia and speech originating from central nervous system disease. When used in this way, it is combined with GB5, LI11, and GB34. It is interesting to note that, judging from the name and indications, this point should be a window of heaven point, but it is not mentioned as one. Its action include two important actions of the window of heaven points, that is subduing rebellious chi from the head and calming the mind. Subdues liver yang in headache, tinnitus, dizziness. Extinguishes interior wind in epilepsy, tetany, convulsions. Calms the mind in fright, fear, palpitation, manic behavior, and also resolves numbness and clears heat in the head, in itchy ears, toothache, swelling, and pain of the gums, goiter. Chapter 21 of the Spiritual Pivot lists 5 points known as the points of the window of heaven: stomach 9, LI 18, Sanjiao 16, bladder 10, lung 3. Chapter 2 of the same text gives an unnamed list of 10 points, which includes the 5 window of heaven points, and adds the points red 22, SI 16, SI 17, Do 16, P1. This passage first discusses rank 22 and then the 6 young channel points as a sequence of vertical lines spreading from the conception vessel and ending with Fingfu. Do 16 on the governing vessel with lung 3 and P1 as additional points. Later commentators, particularly Ma Shi, the great physician of the Ming Dynasty, an expert on the Yellow Emperor Inner Classic, pointed out that this passage discusses SI-17 as a point of Xiaoyang channel, whereas in fact it is a point of the Hantai-Yang channel. They therefore suggested that SI-17 should in fact be GB9. If so, all the 6 young channels would then be represented. These 10 points have certain common properties, being indicated especially for disharmony between the head and body. Disorders of the head and sense organ, goiter, scrofula, rebellion of the lung and stomach chi, and emotional disorders. Many classics indicate GB9 for a variety of mental and psychological diseases characterized by propensity to fear and pride palpitations, epilepsy, madness, etc. According to modern acupuncture research in psychiatric hospitals, many head points are effective in treating disorder of the underlying portion of the brain, and this may help explain these traditional indications.